If you're over 75 and walking has become your only exercise because everything else hurts too much, what I'm about to share might completely change how you approach movement. I recently had a patient who could barely get out of bed in the morning, and within 6 weeks of switching to this specific type of exercise, she was playing with her great-grandchildren on the floor. The exercise that made this possible isn't what most people expect, and it's something your own joints have been begging you to try. I'm Dr. Sophia Reynolds, and as an orthopedic surgeon who has specialized in geriatric joint health for over 20 years, I've seen thousands of seniors struggle with the same frustrating cycle. They walk because their doctor told them to stay active, but their knees, hips, and ankles hurt more with every step. Eventually, they walk less, which makes the stiffness worse, which makes them want to move even less. Today, I'm going to break that cycle by sharing what I recommend to my own patients and why this particular form of exercise outperforms walking for joint stiffness after 75. Before we dive in, if you haven't subscribed yet, I recommend hitting that button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and video suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Now let me tell you about Mr. Henry Patterson, a 78-year-old retired postal worker from Portland. Henry spent 30 years walking mail routes, delivering letters through rain, snow, and sunshine. When he retired, his doctor told him to keep walking to stay healthy. So Henry did exactly that. Every morning at 7, he'd walk around his neighborhood for 30 minutes. But over 2 years, something changed. His knees started aching during the walks. His hips felt stiff when he woke up. His ankles would swell by evening. He pushed through the pain because he thought that's what staying active meant. By the time Henry came to my clinic, he was taking 4 ibuprofen tablets a day. His morning stiffness lasted over an hour. And he told me something that broke my heart. He said walking, the thing he'd done his whole life, now felt like punishment instead of freedom. Here's what most people don't understand about walking after 75. Walking is absolutely beneficial for cardiovascular health, balance, and maintaining independence. But when it comes to joint stiffness specifically, walking has a significant limitation. Every step you take creates an impact force that travels through your ankles, knees, and hips. For younger people with healthy cartilage and strong muscles, this impact is manageable. But after decades of life, that cartilage has thinned, the lubricating fluid in your joints has decreased, and those impact forces start causing inflammation instead of building strength. Walking becomes less about nourishing your joints and more about aggravating them. The exercise that changes everything is aquatic therapy, specifically water-based resistance training. Before you think this sounds complicated or inaccessible, let me explain why this works so remarkably well for people over 75. When you're immersed in water up to your chest, you weigh approximately 10% of your normal body weight. That means if you weigh 150 pounds on land, you effectively weigh only 15 pounds in the pool. Your joints get to move through their full range of motion without bearing the crushing weight they carry all day on land. At the same time, water provides natural resistance in every direction you move, which means your muscles work harder while your joints work easier. It's the perfect combination for reducing stiffness while building the strength that protects those joints. Let me share what happened with Mrs. Clara Henderson, an 82-year-old former elementary school teacher from Boston. Clara loved walking, but severe osteoarthritis in both knees made every walk an ordeal. She would grip her walker tightly, grimacing with each step, taking 20 minutes to walk what used to take her 5. Her daughter brought her to see me after Clara mentioned she'd rather just stay in bed than face another painful walk. During our consultation, Clara was skeptical when I suggested water exercise. She told me she hadn't been swimming since she was a child, and she wasn't about to start wearing a bathing suit at 82. I explained she didn't need to swim a single stroke. She just needed to stand in the pool and move. We started Clara at a local community center with a warm water therapy pool. The temperature was 92 degrees, which immediately helped relax her tight muscles. Her first session lasted just 15 minutes. All she did was walk back and forth in waist-deep water, holding onto the pool edge. She called me that evening, and I'll never forget what she said. For the first time in 3 years, I moved without pain. I actually smiled while exercising, Dr. Reynolds. I forgot that was even possible. Within a month, Clara was spending 45 minutes in the pool 3 times a week, doing leg lifts, knee bends, and even attempting small kicks. Her morning stiffness decreased from 90 minutes to less than 20 minutes. She stopped using her walker inside her house. Most importantly, she stopped seeing movement as something to endure and started seeing it as something to enjoy. If you're still watching and finding this information valuable, comment a checkmark below to show you're with me. This is important because what I'm about to explain next changes how you should think about joint health for the rest of your life. The science behind why water exercise beats walking for joint stiffness comes down to 3 crucial factors. First, buoyancy eliminates impact stress. Every time your foot hits the ground during walking, your knee absorbs a force equal to 3 to 4 times your body weight. Do that thousands of times during a 30-minute walk, and you're essentially hammering your joints repeatedly. In water, that impact disappears. Your joints move freely without compression, which allows the synovial fluid inside your joints to circulate properly. This fluid is like oil in an engine. It needs movement to distribute evenly, but it needs gentle movement, not pounding. Second, water provides resistance that strengthens muscles without straining joints. When you lift your leg in air, you're working against gravity in one direction. When you lift your leg in water, you're working against resistance in both directions as you lift and as you lower. This balanced strengthening builds the muscles around your joints, which are critical for stability and pain reduction. Strong quadriceps muscles, for example, can reduce knee pain by up to 40% because they take pressure off the joint itself. Third, warm water therapy reduces inflammation at a cellular level. When your body is immersed in warm water, your blood vessels dilate, increasing circulation to your joints. This brings more oxygen and nutrients while removing inflammatory waste products that accumulate in stiff, painful joints. The warmth also tells your nervous system to relax, reducing the muscle tension that often accompanies chronic joint pain. Let me tell you about Mr. George Ramirez, a 76-year-old retired construction worker from Denver. George built houses with his hands for 45 years, and his body showed every day of that hard work. His shoulders were so stiff, he couldn't reach above his head to change a light bulb. His hips ached constantly, making it difficult to get in and out of his truck. He'd tried walking on his doctor's recommendation, but the hip pain got worse, not better. George was a proud man who didn't like asking for help, so when simple tasks became impossible, he felt like he was losing his independence and his dignity. When George came to my office, he was frustrated and skeptical. He'd seen 3 other doctors who told him his joints were simply worn out from decades of heavy labor, and he should accept the limitations. I looked at his x-rays and saw significant arthritis in multiple joints, but I also saw something else. I saw muscle atrophy. His muscles had weakened from moving less, which meant his joints had to bear even more stress. It was a vicious cycle, but one I knew we could interrupt. I sent George to a physical therapist who specialized in aquatic rehabilitation. George later told me he felt ridiculous the first day, standing in a pool with a foam noodle under his arms while a young therapist encouraged him to march in place. But by the end of that first 20-minute session, something unexpected happened. His shoulders felt loose. That constant ache in his hips had quieted to a dull background noise instead of a screaming pain. He slept better that night than he had in months. Over 12 weeks, George progressed from basic water walking to resistance exercises using foam dumbbells and leg weights. The water made him feel strong and capable again because he could perform movements that were impossible on land. He could squat deeply without his knees screaming in protest. He could raise his arms overhead in a way he hadn't done in 5 years. By week 8, George told me something profound. He said he'd forgotten what it felt like to move without planning every motion, without bracing for pain, without wondering if this would be the movement that finally broke him. The water gave him back the confidence to move freely. Now, you might be wondering about practical concerns. What if you don't have access to a pool? What if you can't swim? What if you're uncomfortable in bathing suits? These are legitimate questions, and I want to address each one because I don't want logistics to keep you from something that could dramatically improve your quality of life. First, you don't need to know how to swim. Most therapeutic water exercise happens in water that's chest deep or shallower, where your feet touch the bottom the entire time. Many programs are specifically designed for non-swimmers, with instructors who understand your concerns. Second, pool access is more available than you might think. Many community centers, YMCAs, senior centers, and even some apartment complexes have pools with specific hours for water exercise classes. Some health insurance plans, particularly Medicare Advantage plans, cover aquatic therapy sessions as part of preventive care. It's worth making a few phone calls to explore options in your area. Third, regarding comfort and modesty, water exercise classes for seniors are typically held in separate areas or during times specifically designated for older adults. Everyone there is in the same situation, focused on their health rather than appearance. Many participants wear swim shorts and t-shirts rather than traditional swimsuits. The goal is movement and pain relief, not fashion. But what if you're thinking this sounds interesting, but you're not ready to commit to a pool program yet? Are there modifications that capture some of these benefits at home? The answer is yes, though they won't be quite as effective as full water immersion. Let me introduce you to Mrs. Diane Foster, a 79-year-old retired nurse from Minneapolis who found a creative solution. Diane had knee replacement surgery on her right knee 8 years ago, and while the surgery was successful initially, she'd developed significant stiffness and pain in both knees over the past 2 years. She lived in a small apartment with no access to a pool, and the nearest community center with aquatic programs was 40 minutes away. Diane was determined and practical, qualities she'd developed over 35 years of nursing. She started doing what she called bathtub exercises. Every evening before bed, Diane would fill her bathtub with warm water as high as it would go, sit on a bath chair, and do gentle range of motion exercises with her legs and ankles. She'd flex and point her feet, rotate her ankles, bend and straighten her knees as much as the tub allowed. Was it as good as a full pool session? No. But did it help? Absolutely. Diane reported that her morning stiffness improved noticeably, and the evening routine became a peaceful ritual that helped her sleep. When I saw her for a follow-up 3 months later, she moved with more ease and confidence. She'd proven that even modified water therapy in a home bathtub could make a meaningful difference. The key principle here is that any form of low-impact, resistance-based movement in a supportive environment is better than high-impact exercise that causes pain and inflammation. If full pool access isn't feasible right now, even partial water immersion combined with gentle movement can help maintain joint mobility and reduce stiffness. Now let me address something crucial that often gets overlooked in discussions about exercise for seniors. The psychological component of chronic joint pain and stiffness is just as important as the physical aspect. When every movement hurts, when getting out of bed requires a mental pep talk, when you have to plan your entire day around how much pain you can tolerate, it affects your mental health profoundly. Depression and anxiety are significantly higher among seniors with chronic joint pain, not because they're weak, but because pain is exhausting and isolating. Mr. Robert Chen, an 80-year-old retired pharmacist from San Francisco, embodied this struggle. Robert had been an active man his whole life. He hiked, played tennis, and traveled extensively with his wife. But progressive osteoarthritis in his knees, hips, and lower back gradually stole those activities from him. By the time I met Robert, he'd become withdrawn and depressed. His wife told me he'd stopped making plans with friends because he couldn't predict when his pain would be manageable. He felt like a burden to his family because he needed help with tasks he'd always done independently. What struck me most about Robert was how defeated he sounded when describing his attempts to stay active. He'd tried walking, as his primary care doctor suggested. The pain increased. He tried stationary biking. His knees swelled. He tried yoga. His hips screamed in protest. Each failed attempt reinforced his belief that his body had simply given up on him, that pain and limitation were now his permanent reality. This is the insidious nature of joint pain in older adults. It doesn't just limit physical movement, it limits hope. When I suggested aquatic therapy to Robert, he was hesitant but willing to try one more thing. His wife found a warm water arthritis class at a local hospital's rehabilitation center. The class met 3 times a week and was specifically designed for people with severe joint pain. Robert attended his first class on a Tuesday morning, and by Friday, his wife called me with an update. She said Robert came home from that first session and smiled for the first time in months. Really smiled, not the polite smile he'd been giving everyone to hide his misery. A genuine smile of relief and possibility. What happened in that pool wasn't just physical relief, though that was certainly part of it. Robert experienced something he'd lost, the feeling of capability. In the water, he could move without wincing. He could participate in an activity alongside other people instead of watching from the sidelines. He could push himself without punishment. Over the next 3 months, Robert's transformation was remarkable. His pain levels decreased, his range of motion improved, but more importantly, his entire demeanor changed. He started making lunch plans with friends again. He talked about future trips he wanted to take. He laughed more easily. The physical relief from water exercise gave him back more than just easier movement. It gave him back his sense of self. If you've been dealing with joint stiffness and pain, I want you to understand something important. The goal isn't to become pain-free, though that would be wonderful. The goal is to reduce your pain enough that it no longer controls your life. To decrease your stiffness enough that morning movements don't require 30 minutes of warming up. To strengthen your body enough that you feel stable and confident rather than fragile and fearful. Aquatic exercise can help you reach these goals in a way that walking alone often cannot. Let me give you some practical guidance on how to start if you're interested in exploring water exercise. First, talk to your doctor. Explain that you're experiencing joint stiffness and pain with walking, and you'd like to try aquatic therapy. Ask if there are any medical reasons you shouldn't exercise in water. Most doctors will be supportive, especially if they understand the challenges you're facing with land-based exercise. Second, research local options. Call your community center, YMCA, hospital rehabilitation departments, and senior centers. Ask specifically about warm water therapy classes or aquatic arthritis programs. Many facilities offer trial sessions so you can experience the environment before committing. Some even provide specialized equipment like pool lifts or stairs with handrails to make entering the water safe and manageable. Third, start slowly and listen to your body. Your first few sessions should be short, perhaps 15 to 20 minutes, focusing on simple movements like walking forward and backward, gentle leg lifts, and arm movements. The water will feel supportive and different, and you may find you can do more than you expect. But resist the urge to overdo it on day 1. Your body needs time to adapt to this new form of movement. Fourth, consistency matters more than intensity. 3 20-minute sessions per week will produce better results than one 60-minute session. Regular, gentle movement gives your joints the steady stimulation they need to maintain and improve mobility without causing flare-ups of inflammation. Fifth, combine water exercise with other joint-friendly practices. Continue taking any medications your doctor has prescribed. Consider anti-inflammatory foods like fatty fish, berries, and leafy greens. Stay hydrated. Get adequate sleep, as your body repairs joint tissues during deep sleep. Water exercise is powerful, but it works best as part of a comprehensive approach to joint health. Now, I know some of you might be thinking that your joint problems are too severe for exercise to help. You might believe that your arthritis is so advanced or your pain is so constant that nothing will make a meaningful difference. I understand that feeling because I hear it regularly from patients who've lived with chronic pain for years. But I want to share one more story that might change your perspective. Mrs. Margaret Sullivan, an 84-year-old retired librarian from Charleston, came to my office in a wheelchair. She had severe osteoarthritis in both knees, both hips, and her lower spine. She'd had one knee replacement that had complications, making her fearful of additional surgery. Her pain was so limiting that she'd stopped walking entirely, relying on the wheelchair for all mobility. Margaret was intelligent, articulate, and utterly convinced that she would spend the rest of her life unable to walk. I proposed aquatic therapy, not promising that she'd walk again, but suggesting we could at least maintain her remaining joint function and possibly reduce her pain levels. Margaret was skeptical but agreed, mostly because her daughter insisted. The facility we used had a pool lift that lowered Margaret directly into the water while she remained seated, eliminating any need to navigate stairs or pool edges. The first time Margaret was in the water, suspended by flotation devices with a therapist supporting her, something remarkable happened. She moved her legs. Not weight-bearing steps, but gentle kicks and bends that she couldn't do on land. The buoyancy made movements possible that gravity had stolen from her. She cried during that first session, and later told me they were tears of relief. She'd forgotten her body could move without agony. Over 6 months of twice-weekly sessions, Margaret progressed in ways that surprised everyone, including herself. She began bearing partial weight on her legs while holding the pool edge. Then she took steps in chest-deep water with therapist support. Eventually, she could walk the width of the pool independently, something she hadn't done on land in over a year. Did Margaret throw away her wheelchair? No, her joint damage was too extensive for that. But she regained enough strength and confidence that she could transfer from her wheelchair to her favorite chair at home without assistance. She could stand at her kitchen counter to make tea. She could take a few steps to her bathroom at night without calling for help. Margaret's story illustrates an important truth about exercise for severe joint problems. The goal isn't always about returning to how you were 20 years ago. Sometimes the goal is about preserving what you have, or reclaiming small pieces of independence that make daily life more manageable and dignified. Even people with advanced arthritis can benefit from appropriate exercise, and water provides the safest, most supportive environment for that movement. Before we wrap up, I want to address one final concern that often comes up. What about cost? Aquatic therapy sessions can range from free community programs to paid physical therapy sessions that may or may not be covered by insurance. Here's my advice. Start by exploring free or low-cost options like community center classes or senior center programs. Many of these are specifically funded to serve older adults and cost less than $10 per session, sometimes nothing at all. If your pain and stiffness are severe enough to significantly limit your daily activities, ask your doctor about a prescription for physical therapy, which may include aquatic sessions covered by insurance. Even if you end up paying out of pocket, consider the cost comparison. Daily pain medications, doctor visits for pain management, assistive devices, and the potential costs of falling or losing independence due to muscle weakness often exceed the cost of preventive exercise programs. Let me bring this all together with what you need to remember. Walking is valuable for many aspects of health, but after 75, when joint stiffness and pain become significant issues, walking alone may not be enough. In fact, it may be contributing to your discomfort rather than relieving it. Aquatic exercise, particularly in warm water, provides the perfect combination of joint decompression, muscle strengthening, and pain relief that your body needs at this stage of life. The buoyancy eliminates painful impact, the resistance builds protective muscle, and the warmth reduces inflammation. These three factors working together can dramatically reduce morning stiffness, decrease daily pain levels, and restore movement patterns you thought were lost forever. If you take nothing else from this video, take this. Your joint stiffness is not something you simply have to accept and endure. You have options, and one of the most effective options is literally as close as your nearest pool. Whether you start with a formal aquatic therapy program, a community water exercise class, or even gentle movements in your own bathtub, adding water-based movement to your routine can change your relationship with your body. Instead of feeling betrayed by joints that hurt with every step, you can feel supported by an environment that lets you move freely. Instead of dreading exercise because it increases your pain, you can look forward to sessions that leave you feeling loose and capable. I encourage you to take one small step this week. Make one phone call to a local facility about water exercise classes. Talk to your doctor about whether aquatic therapy might help your specific situation. Research pool access in your community. Watch videos of senior water exercise classes to see what they're actually like. Just do something to move this from an interesting idea to a practical possibility in your life. Your joints have carried you faithfully for 75 or more years. They deserve an exercise approach that supports them rather than stressing them further. Water exercise offers that support in a way that land-based walking cannot match when joint stiffness is your primary concern. You don't have to accept increasing limitation and pain as inevitable parts of aging. You have more control and more options than you might realize. If you found this information helpful, please share it with friends or family members who struggle with joint stiffness. Leave a comment below telling me about your experience with joint pain or any questions you have about starting aquatic exercise. I read every comment and use your feedback to create more videos addressing the health concerns that matter most to you. Remember, I'm here to provide information and support, but always discuss any new exercise program with your personal physician before starting, especially if you have other health conditions that might be affected. Thank you for watching, and I hope this information empowers you to take action toward more comfortable, confident movement in your daily life.